My friend is about welcome to medical science class. As a student of medical science, I wanted to take the very good answer of medical science. What people think say that is not very knowledge, very good, and that is about it. As soon as the value the one and only key to accept all equation last time decimal system. How much percent okay? Yeah, alif lam nam yellow shabi lam nam hamar abdul manushu shabi nam. Now my friend is about our medical science class. I learned medical science because medical science. By the name of constant material space, science will knowledge. Science will knowledge. And knowledge come from one only key. Allah say by Quran verse, Ikra bismi rabbikal ladzi khalaq khalaqal insana min 'alaq wa rabbukal akram alladzi 'allama bil qalam 'allamal insana ma lam ya'lam. Now my friend is about our medical science class we done. In that verse Allah say give important read about one indicator also creation then creation. Now medical science class we discussed elaborated about pulse and now elaborated about musculoskeletal pain also already described, and we elaborated about in case of muscle pain, musculoskeletal pain in case of muscle. How you understand that musculoskeletal pain, if that is muscle or bone? In case of muscle pain, if muscle contracted any situation by any traumatic injury or any brain injury or other injury, then how you understand? If you press the muscle, that feel pain. Joint movement, no pain. That is the, by that policy you can understand muscle. In case of muscle pain, there is a musculoskeletal pain, muscle pain, there is a muscle pain that MSCOO7 and proton pump inhibitor. But in case of muscle pain, muscle relaxant utilize. That is good. If muscle contracted, muscle contraction is. Now we discuss about tingling sensation. That sensation is called nerve injury or anything wrong occur with nerve. Tingling sensation. Tingling sensation বাংলায় বলে জিজি করা tingling sensation in that nerve injury or nerve anything wrong occur, we utilize a vitamin B3 B6 B12 combination. In case of burning pain, somebody say my body is burning, there is a burning. But what is the burning pain occur? First take history carefully. Why burning pain occur? What is the reason? Try to find out. In drug there is an antihistamine. Fexofenadine. There is the treatment of choice of burning sensation. But what is the reason? First find out the cause. If not find out any cause, then it can be allergic particle, itching, but anything wrong like that. Antihistamine is the treatment of choice. Fexofenadine. You can examine that those have burning sensation. We take fexofenadine. It's working. And those have muscle contraction, muscle cramp, muscle stabilize muscle relaxation. Now my friend was about body ache. What is the treatment of choice body ache? There is a message. If no fever, no sign of inflammation, body ache, there is a muscle. In body ache there is a message. There is a for muscle pain reduce spa or muscle exercise or muscle press the muscle pain. Muscle relaxing can be used in that situation. Then you body ache. What is the reason of body ache? Find out that. Treat that. But acetaminophen is a treatment of choice. If there is no sign of inflammation in the area, then acetaminophen is the treatment of choice. Now my friend was about we discussed about a medical common cause. In case of common cold, the treatment of choice, common flu virus, it is usually within a week can cure. But is severe or anything wrong, antihistamine is the treatment of choice, running nose and common flu, and antibiotic. Now my friend was about treatment. You have tonsillitis, infection with tonsil. What is the treatment of choice? Management. Then what is the cause? Tonsillitis. Treat the cause. Then antibiotic in case of treatment of choice and antibiotic ciprofloxacin. Ciprofloxacin is the treatment of choice. Tonsillitis. How you identify you have tonsil? You see the under the submandibular, which is this area, and swelling, rubor color, dollar, rubor color, in case of rubor redness, in case of color raise of temperature, dollar loss of function, in case of tumor, swelling. The tonsil is swelled. There is a difficulty of swallowing, but not like epiglottitis. It is not like epiglottitis. Now I went with about tonsillitis treatment of choice. Now you are understanding tonsil, latent tonsil is large. There is a difficulty of swallowing and pain. And sign of inflammation. Also in case of fever, and you understand that there is an infection in this area, tonsillitis. Why you go to tonsillectomy? Tonsil infection is cured by antibiotic. Why go to the tonsillitis? There is an indication of tonsillitis. This tonsillitis occurs recurrently, and tonsillitis infection is not cured by antibiotic. Already so many times occur, but that is not cured. In that situation, tonsillectomy. There is other reason for tonsillectomy. If indicated for tonsillectomy, then tonsillectomy. But in case of tonsillectomy, you know that there is a procedure, general anesthesia, and go to the oral route and come the tonsil and which are given to the tonsil area, then cut the tonsil. But in case of tonsillectomy operation, if indicated, then otherwise. What is the indication of tonsillectomy? But better than is by antibiotic or medicine. Surgery is the when the indication of tonsillitis or surgery necessary, and indication of surgery, then do surgery otherwise. Thank you very much, my friend. Thank you very much, my friend supporter. Today is enough from the science class. Now, my friend supporter, today I take Part 1. After taking Part 1, I give lecture. Before I say anyone understand, I take Part 1. After addiction, why people do anything wrong, I don't understand. Because in my, as a doctor, narcotic department experiment, by experimental purpose, also addiction purpose. Speak truth, honesty, that. After taking narcotic product, why human do criminalism? I don't understand. That is the reason I also testify already one by one narcotic product can testify. And after taking narcotic product, I try to give lecture and lose. Why human do anything wrong, I don't understand. After taking narcotic product. Thank you very much, my friend supporter. Today is an from medical science. Any question occur? Thank you very much. I seek permission from one and only ALLAHU, then international court. I want and willingly taking in the narcotic product for experimental purpose, also addiction purpose. And in that situation, I say to international court, I send request to other court, country Supreme Court. I should have right to take narcotic product. Defense, there is a right. Those that remain with me, they should have also right to act. As a doctor, I seek permission from international court. And you know that as a doctor, MSC use the permission. After taking narcotic department, like marijuana, I can take. And in my professional time, I also wanted to take drains, narcotic department, narcotic product. And those are patients, believe as a doctor, they come. Those are not believe as a doctor, not come. Honestly speaking, I all time I wanna to take drains, smoking, also narcotic program, like hearing, cooking, experimental purpose, also addiction purpose. I should have. And I seek permission. I wanted to give to other right because of my patient right, narcotic product, drug, penicillin, morphine, permission. And you know that in case of my current situation, MSC, you use you know that I already said. And for my patient, narcotic product, also drug, I seek permission from national court to give them right. And my professional time, I also can take narcotic product and drug. And as a doctor, those are my patient, and also my blood connected friends and supporter. They should have the right to take, and they remain with you. And if anyone disturb, that will be the case. It will be the case and go to the GD case. I think nobody disturb in that case. As a doctor, as a Muslim, you know that Muslim scientists, I should have tried to research about that. Also addiction purpose. In my professional time, I also seek permission. Those patients come me, believe me as a doctor. If any harm occur, anything wrong occur, I am not responsible for that reason. My one and only capable was responsible for that. Your risks and your I not take any risks. If die, I am not responsible. My one and only kid. By arrow, one question. Okay, fine. I've taken one gun. I give it to treatment. Ya Ali Damla. Yallah Shafi Illa Nakul. Anar Abdul Mamushi Shafi. Anar Abdul Mamushi Nakul. Anar Abdul Mamushi Shafi Alamda. Anar Abdul Mamushi Shafi. Thank you very much, my friend. That is the purpose I say sorry to one and only Creator Allah. Also say sorry to my friend and supporter. Don't mind. If you mind, I never share.